We are bringing you live STEMI India 2018 live from Lucknow. Let me introduce our guest for today. Dr. Venu Menon is with us. He is the Director of Intensive Cardiac Care Units, Director of Cardiovascular Fellowship and Professor of Medicine from Cleveland Clinic. So let me begin the questions with you. That should the patients with cardiac arrest be treated with therapeutic hyperthermia?
I think that's a very important question. When people have an out-of-hospital cardiac arrest, we think it's a class 1 indication, which means you should certainly strongly consider treating patients with arrest with therapeutic hypothermia, because if you have an out-of-hospital cardiac arrest in this situation, therapeutic hypothermia has been related with increased chance of survival compared to placebo, and also it has an improved neurological outcome. So it is the one definite thing for out-of-hospital cardiac arrest that we feel alters their prognosis, and so I would encourage using it strongly.
So sir, and what is the role of temporary mechanical support in cardiogenic shock?
Now, temporary mechanical support has revolutionized the care of patients with cardiogenic shock. These temporary mechanical devices allow us to stable the hemodynamics of the patient and preserve end organ function. So when patients come to us with shock, let's say with a large myocardial infarction, and they remain hemodynamically unstable despite revascularization, putting them on these temporary devices gives us the time to allow the ventricle to recover, as well as to make decisions that we call bridge decisions to recovery. So there will be a group of patients who we put on these support devices who will improve on their own. That's a really good thing. They can be discharged from the hospital and live with a good prognosis. There are another group of patients who, when we put them on the support devices, continue to do very poorly. They have end organ injury. There's not much we can do to further improve their prognosis as physicians, and so in that case we may be able to talk to the family, let them know that their loved one is doing very poorly and will ultimately pass away. And then there will be a group of patients who we may be able to offer newer support devices like durable LVADs and transplantation. So when we did not have these devices, we were not able to meaningfully make these decisions in emergent situations. But having these devices gives us the time and the opportunity to make these decisions for our patients.
Thank you so much for sharing your views at the STEMI India 2018 platform, sir. Thank you so much.
Thank you for the opportunity.
Thank you.